and namaste, guys. I am Dr. Anushruti and I am back with an amazing episode. Today on board, I have Dr. Jimo, who is a physical therapist by profession and a coach. If you go through his Instagram profile, you would see how much he is into athlete training. And I know all the athletes who are listening and watching this episode are going to just give him a follow on Instagram and various profiles. So why not to just directly speak to him when he is right in front of us? Hello, Dr. Jimo, how are you?
I'm doing well. Thank you so much for having me.
Thank you so much. Well, today you've got to answer a lot of questions about physical therapy. So, are you ready to go?
Let's fire away.
Okay. So, my first question would be, why did you choose physical therapy as a profession, and what was the biggest lesson you have just learned about in your career?
So, if I had to go back on the story on why I chose it as a profession, it goes back to my upbringing. So, I was, you could say, like a fat kid, like an overweight kid. I ate a lot and didn't do a lot of activity up until I was a teenager. And then when got to high school, I started doing sports and weightlifting and just discovered what the human body was capable of when you actually made it work, when you actually stressed it. Fast forward several years, I have injuries in sports that I played, and I had a really good physical therapist that is still kind of in my life, was my mentor all through undergrad and grad school, and helped me really kind of decide, like, you know what, this is something I want to do. The way that he creates relationships with people, the way he can motivate people, the way he sees individuals go from unable to walk due to pain, or crippled by something because they can't use their shoulder, their back, or their knee, to the point where they're back to playing sports, or playing with their kids, or whatever their goals are. So that motivated me, and kind of made me say, like, you know what, I think I want to go into this profession. And like, fast forward again, that was I don't even remember now. That was, when did I graduate high school? 15, 18 years ago. I don't know how it is, but fast forward, and I've learned so much about what the profession is. And even from the 7 years, so 2015 I graduated, 7, 8 years that I've been practicing, I've learned so much more that we can do as a profession. And it's only inspired me and motivated me to do more as a physical therapist, to use my skill set, from a strength conditioning background, from a rehab background, and combine those, kind of the idea of like bridging the gap, which everyone says they're bridging the gap, but how many of us are actually truly doing that? That's kind of what's kept the fire going for me the last several years.
That's so great. Well, how do you feel like how much physical therapy plays an important role in people's life, health, and well being? Also, why is it important and how much is it important for people to understand physical therapy in general? The importance of physical therapy in their lives.
Unfortunately, I don't think it's known enough, right? People have a bad experience with physical therapy, or they just get a random script to go see a physical therapist, and they assume I'm just going to go in there, maybe get a massage, maybe get a hot pack, maybe get some e-stim, right? And there's a couple of things to blame. One, we're not as vocal, right? We're not out there doing like big marketing things. People don't know what physical therapy looks like a lot of times, or what it consists of, or what our skill set allows us to do. But number two, a lot of the individuals in the profession, unfortunately, are still stuck in kind of this really like old school way of treating individuals, where they will get them on the table, overanalyze everything, take a look at every single thing possible, and then when they finish the evaluation, they still have no idea what's going on with that patient, or they have like a guess, but they're not really sure, and their treatment approach is very, without like sounding rude, like very low level. Like, they're not truly stressing people. They're not truly giving them a challenge that allows their bodies to get stronger and improve overall quality of life. And I feel like that's what people are missing when they think of PT, and that's what our profession needs to be much better at vocalizing and demonstrating, and also doing as a PT. Right? We have the capability to help individuals in pain get out of pain. We've known that, right? That's kind of what our thing is, and the human body is fantastic and resilient and gets stronger and everything on its own. But we have a skill set that can help people improve those things, and also improve quality of life, get stronger, finish their plan of care, and then like, hey, I can live independently until I'm 70, 80 years old. I can lift weights, I can play with my great grandkids, my grandkids. Like that is what I wish more people knew about PT. And I think that's where a lot of times we miss the mark, as far as like a profession having that one kind of message to deliver out there.
Absolutely. With this, I would also like to know how much do you feel physical therapy is more than about just modalities? Because you just told about some physios who use the traditional way, the old way. So, how much do you feel that physical therapy is a lot more than IFTs, TENS, ultrasonic therapy? What is physical therapy exactly? The wide range of physical therapy.
So that's a loaded question right there. What is physical therapy? Um, as you mentioned, right, I believe and I truly think that we are more than modalities, right? We need to be more than that. We need to get away from it. There is a time and a place for them. I don't want to discredit them. There are individuals who, if you look at the placebo effect or the ability to kind of like just gate pain, like there are those times when you're going to use electrical stimulation or maybe some ultrasound because someone's had a really good experience in the past with it. The issue is so many times that's where it ends, right? They get their ultrasound treatment, they get their e-stim, they get a light banded exercise, and they're sent out the door. And that's repeated 3 times a week for 6 weeks or whatever. The issue is we need to be good at maybe understanding when those modalities are appropriate to use. And I myself, I use like dry needling with electrical stimulation. I do spinal manipulation, things like that. I use those to gate pain, to reduce someone's symptoms in order to open up that window where we can load somebody, where we can truly create a progressive adaptation to get someone stronger and to make their tissue more resilient so the likelihood of injury is less and their function is higher. And so I think that's where it is, right? PT is not just those modalities, but PT can use those modalities. We just need to leverage them in the right way to open up that window to leverage the stuff we know makes long lasting changes.
Coronavirus. I know this word is something, everyone who's listening and watching this would have got a flashback of memories. I would say nightmares, actually. So, coronavirus just added fuel to fire.
Mhm.
Earlier, before March 2019, at least for India, what was the onset year for your country of coronavirus?
It was, I think, March 2020, April 2020 is when everything kind of shut down.
2020 or 2019?
2019, 2019. I'm sorry.
2019, yeah,
Thank
yeah.
you. Yeah. I
Yes.
had
So
to think
even
about
in
that.
India, it was March 2019. And before that, people, just did not know about health. And eventually, coronavirus came in. People just tend to have their desk jobs, work from homes, and everything just became worse. Now we have some set of people who actually went into their holistic health and just deep dive into their health, but still the majority of population are those who have actually I would say deteriorated in terms of their health. So how much do you feel coronavirus has affected people, and with the onset of coronavirus, how much changes have you seen in your practice, in your clinical practice?
So I think, unfortunately, not enough of an impact, if that makes sense, right? The idea that like the studies are just coming out now, which is ridiculous because we've actually known this for several years. That individuals who are in better health, who are in better shape, who had overall like reduced body fat or like improved body composition, the outcomes for those individuals were generally much better. And when we saw like you saw it kind of like if you when you like 1,000 foot view looking at people like, oh, like healthier people for the most part were doing better when they did get coronavirus or COVID-19. Whereas individuals who maybe had higher body fat percentage, who were more immunocompromised, who had all these other things going on with them, they struggled more with it. They were hit harder. And even though that was seen, the evidence that's coming out now showing like, hey, like not to say it again, but if you're healthier, you're gonna do better with pretty much any sickness, any disease, right? If you're healthier, if you're stronger, you're gonna do better and you're gonna feel the impact less. And unfortunately, you did see some individuals like, you know what, I need to take charge of my life, take charge of my health. I need to watch what I eat. I need to drink more water, be more active. But unfortunately, there's a lot of people who still don't see that. And I think it just depends on the personality of the person. But you saw people who basically close themselves off and like, I need to not go outside. I need to not go to the gym. I need to stay away from everybody. And you had the flip of people like, I need to go to the gym. I need to figure out. I'll wear a mask if I have to, and exercise and eat well and things like that. Um, but I think it's probably a mixed bag. There's not this huge, unfortunately, not a huge swing towards healthy lifestyle behavior changes. But there isn't also like no swing at all. And then as far as our practice, do you mean from like what we did and what we do as physical therapists, or what do you mean by how it affected my practice or how it has affected my practice?
As in the patients in person in your clinical area, and then the telecommunication tele-rehab.
Yeah, the telecommunication was fantastic because it allowed for a way for us to still see patients, to still work with them one on one, just not in person. Especially during the beginning when it was shut down and people weren't allowed to like leave their home or people just didn't feel comfortable. It allowed for a way to treat people, work with them, and communicate with them. And not only that, but show them the importance of movement. The cool part with that was you saw people get better without ever being touched, if that makes sense, right? I never massaged a shoulder. I never mobilized a joint. I didn't do any of those things
Yes.
because you could not. But all of a sudden, they're doing these exercises. They're doing these self mobilizations. They're doing just some things to get a little bit of sweat going. And they're like, oh my gosh, my shoulder, my knee, it feels better. And it kind of opened up some eyes, like, oh my gosh, like I just need to move, and that helped. Is like, yeah, like it's really that simple sometimes. Obviously, like
Magic.
yeah. So that's what it opened up a lot for us, for people to be like, oh, okay, cool. And then there's more of a buy-in when they come into our clinic space, which our clinic is a lot like almost like a personal training studio. We have squat rack and assault or echo bikes and a rower and a skier and dumbbells and barbells. And we load people up and then they're like, oh, I have plantar fasciitis. I stretched a lot. And I'm like, well, let's load that foot and that ankle. And they're like, my foot feels better. It's the opposite. I thought it would hurt more. And like all of a sudden you get more buy-in because they see, oh, movement is medicine, right? That saying that's been around forever. Like, oh, this
Yes.
does really make a difference.
Absolutely. Absolutely. Movement is medicine. Moving on, Dr. Jimo, we have a question from Get Gritty. Now, we are having a Get Gritty question. Get Gritty with Dr. Anushruti is my podcast. So, we have a Get Gritty question for you. And the question is about ergonomics. People do not know about this. What they do know is having a table and their laptop sit on, and just that. This is how they work. What do you want to say specifically for people who are doing work from home?
So the best thing I would have to say towards that is like one of my favorite saying is your best posture is your next posture, right? A lot of people get really drawn into the idea of like, oh, I'm at a computer all day, like that's the reason I have pain all the time. But then you look at like, like a grandpa down the road and he's like kyphotic like crazy, no pain at all. So how is it that this 35-year-old is barely has kyphosis and he's in a lot of pain, but the guy who has a rounded shoulders for 40 years is totally happy, no discomfort or pain at all. So what I always recommend for anybody who works from a desk is if you have the capacity to try every 30 minutes or so just to get up, go for a quick 2 or 3 minute walk around your house, move around a little bit. If you can do that, then on days when you're not working or when you have that time when you exercise, focus on strengthening the musculature of your upper back and your mid back. What we know is typically weak muscles are going to be stiff muscles. So if we're really stiff on our upper back, can we strengthen those to make them a little stronger? And as soon as they're stronger, that helps us just sit a little bit more upright. It's not that I'm focusing on staying in that position. It's like, oh, my body is used to this. This is where it's comfortable. And you can explore that full range of motion and express that a lot better if you practice that throughout your week or throughout your day, things of that nature.
Absolutely. Well, cold pack or hot pack? These two terms are what people get confused about. We have first aid kind of things. So, for the physical therapy first aid, we say it is either cold pack or hot pack. Please enlighten every listener and viewer right now when to use a hot pack and when to use a cold pack.
So I don't know if you've seen it. There's the British Journal of Sports Medicine recently came out with their guidelines for acute injuries. Not recently, I think it's actually been like 4 or 5 years. But the old adage of RICE, like rest, ice, compression, elevation, like that has been, they basically said like, hey, that's not what we want people to follow anymore. Instead, what we want to follow is something that they name demonically peace and love, which is protection, elevation, activity. So just getting yourself moving, whatever is comfortable, compression, and I believe exercise. So getting cardiovascular fitness there. And then there's love, which is load, optimism, vascularization, which again is promoting blood flow. And then I do not remember what the last E is. But if you look it up, BJSM, peace and love, like that is what they're going for. So from me, I typically, if someone has an acute injury, my first go-to is like, hey, let's just gently keep it moving. Let's get that joint moving, whatever's hurt. Let's get that moving a little bit more. What can you do? Like, if you cannot run, can you gently bike, or can you get on something like an assault bike or an air bike where you can use one leg and two arms and let that other leg rest a little bit? So I'm typically not telling people to use ice immediately unless they're in such severe pain that they can then use ice to kind of like numb it a little bit or make it feel a little bit better, because it is going to feel better when you ice it, but it also slows down that whole inflammatory process that we want to take place after an injury. So if I have to give like a general like umbrella, this is what we do. I say you're going to ice right off the bat. If you need to ice it. I'd rather you move and do some light compression. But if you need to ice in the beginning. After you're through that initial acute phase, maybe like 5 days or so, there's no redness, there's no continued like increased swelling. Then I'm kind of, I don't care what you do. I like people feel really good when they warm their joints. So I'm like, okay, get a little bit of warmth on there and then get it moving. If there's no active infection, if it's not continually red and getting puffier and bigger, then heat's not going to be bad for it. But we know that like a hot pack or an ice pack isn't strong enough to really get into those deep tissues where we have effusion and things going on in the joint. So it's honestly, it's kind of whatever feels better. Feel free to use either one. That is my professional, personal opinion on the matter of hot pack versus cold pack.
Okay, great. Well, last but not the least, Dr. Gmo, we have a lot of students over here, the next generation of physical therapists. So, what would be your biggest piece of advice for them?
Hands down would be to adopt a movement practice. Adopt something that you are either passionate about, that you enjoy doing, whether it be yoga or I do CrossFit, right? CrossFit weightlifting, or just like bodybuilding or something where you are actually loading yourself, stressing your body, getting stronger, being active, being fit. There's something we say that in the Institute of Clinical Excellence, they say hashtag be about it. The patients we work with, the people we work with are going to trust and believe in us more when we tell them, I need you to get stronger, or this is how you get stronger. When we look and act and live a lifestyle that demonstrates to them, like, oh, this person knows what he's talking about. This person actually lives out what he's trying to tell me to do.
Yeah.
Yeah. And unfortunately, too often in our profession, we see people who like go out into the field and have never squatted a bar or never done a deadlift or never like trained with heavy weight. And we know like scientifically, like you need high loads or like high stressors to create muscle mass and strength. Yet everyone says on their goals for physical therapy, get stronger, get stronger, get stronger, but they never actually use loads or
Yes.
rep schemes or things that get people stronger. So I would say adopt a movement practice so you know what it's like to work hard. So when you tell a patient like, hey, I need this to feel difficult, this is what it should ideally feel like. This is what a squat should look like and feel like. This is what a deadlift or a press should feel like. They can actually say those words and know that they're delivering it with some meaning versus just kind of blanket statements saying, I need you to do this, and then hoping the patient understands.
I would just sum it up by saying the change you want to see in your society, the change you want to see in your patients, first bring that change in your own self. Well, with this, we have come to an end of this episode. Thank you so much, Dr. Gmo, for bringing in all the information about physical therapy for my audience and taking out time from your schedule. Thank you so much. I really hope you enjoyed it as much as we did listening and speaking to you.
My pleasure. Thank you so much for having me.
Thank you so much. Well, with this is your reminder to straighten your back, have a glass of water, and move. We'll see in the next episode. Till then, goodbye. Take care.